Erectile dysfunction is a medical disease which results in not being able to maintain an erection to completion of intercourse or be able to obtain an erection sufficient for penetration for intercourse. Erectile dysfunction is quite common. How common it is depends on what are your other medical conditions and what is your age. It's reported that up to 50% of men over the age of 50 have some sort of erectile dysfunction. When you get up into the age of around 70 to 80% of men have some degree of trouble with erections. Erectile dysfunction can have both medical and surgical causes. Common medical conditions that can result in erectile dysfunction include high blood pressure or hypertension, diabetes, smoking, certain medications, obesity or being overweight, high cholesterol, and heart disease. Surgical conditions can also result in erectile dysfunction. Common surgeries associated with erectile dysfunction include prostate surgery as well as colon surgery. Erectile dysfunction is most commonly diagnosed with a patient complaint. Patients describe either trouble obtaining an erection or trouble maintaining an erection through the completion of intercourse. Specialized testing that we do for erectile dysfunction most commonly includes a questionnaire called a SHIM or an IIEF, asking about qualities of the erection, duration of erection, confidence in erection. And sometimes in men where we're concerned of is it a vascular problem or a neural problem, we can do special testing called Doppler ultrasound, which includes an injection to create blood flow into the penis, followed by ultrasound measurements of arterial flow into the penis and venous flow out of the penis. And that can help us with more complex cases. Can ED be prevented is a complicated question. Certainly, good lifestyle habits such as maintaining a healthy weight, eating healthy, stopping smoking, and good care of chronic medical conditions such as high blood pressure and diabetes can help stave off the effects of erectile dysfunction. However, in some men, erectile dysfunction, because of their medical conditions or as they get older, is inevitable. The good news is erectile dysfunction is very treatable. What are the benefits of seeing a specialist for erectile dysfunction? Well, a specialist for erectile dysfunction can offer all the treatments available. Sometimes, including your regular doctor or a men's clinic, sometimes they just don't have experience with all of the options, which include medications, injections, vacuum devices, and even curative penile implants. The treatment options for erectile dysfunction include 5 things. The most common treatment option, as many of you know, is the oral medications. There are 4 available oral medications on the market right now. The 2 most common are Viagra and Cialis, or their generics, known as sildenafil and tadalafil. They are now generic and eminently cheap, using apps such as the GoodRx program. More invasive options for erectile dysfunction in men who the pills are no longer working include injections such as trimix injections, as well as vacuum devices, which is a device that goes over the penis, pulls blood in, and has a rubber ring that holds the blood in the penis, as well as curative penile implants, which are men who have failed conservative measures and want a permanent solution to their erectile dysfunction. How do you determine which treatment is right for me? Well, generally the simplest solution is the best. If medications are efficacious and tolerated well, no side effects, then medications are right for you. If medications aren't giving you the results you looking for as far as the duration of erection or ability to get an erection, then it's time to look at the other 3 options. Some men have issues with needles or the issues with not wanting to keep a refrigerated medication or take a vacuum device with them on vacation or when traveling. And some men have concern about procedures. So we really will go over all the options and decide which one is best for you. What are the satisfaction rates of all the different treatments? Well, satisfaction has a lot to do with how well the treatment works. So if the pills are working good, a lot of men are, and they're not having much side effects, then the satisfaction is pretty good. But if they're not working, or they're causing headaches or stuffy sinuses or backaches, blue halos, some men may want to look for other options. The two non-invasive options, the injections and the vacuum, we really know that after about a year, only about 25% of men who start these options are still using them. And that can be from various reasons, pain at the injection site, the erection not feeling as natural as a normal erection. However, with penile implants, 90% of men who had implants put in would recommend it to a friend. 85% of partners are also report satisfaction with the implant. Long-term complications of not having erections can result in penile shortening, as well as scarring, which can result in curvature of the penis. It's really important, especially after prostate surgery, that an aggressive rehab program be commenced.